RN and I'm at the MAR getting ready to prepare medications for Martha May. I'm going to go ahead and start off with washing my hands. I'll go ahead and put some gloves on. Okay, so it looks like the first medication we have here is fluoxetine. 60 milligrams is the order by mouth every morning. So I'm gonna go ahead and get that out. Okay, so I have my fluoxetine right here, and I'm just gonna go ahead and compare this to the MAR, making sure that it's correct for my first check. And then I'm gonna go ahead and see that our fluoxetine order is 60 milligrams. And we have available 20 milligram capsules. And then we're just gonna divide 60 by 20 to give us 3 capsules that we should be giving to our patient. Okay. Okay. I'm gonna go ahead and get these out. Now I'll be putting these in a medication cup. For our patient. And then now that I have that dosage calculated, I'm gonna go ahead and check it one more time, or the second time against the MAR. Okay, 60 milligrams. And then our next medication to prepare is going to be our insulin, NPH 10 units, and our insulin Lispro 2 units. So now that they are out, I'm just going to go ahead and check the expiration date on both. Make sure they are both not cracked or have any damage to them. Also inspecting the safety syringe as well. I'm going to compare these against the MAR as well. Okay, so she needs 10 units of NPH. And she needs 2 units of Lispro. And that's going to equal in total 12 units that we should be administering. So now that we have that, go ahead and prepare. I'm going to go ahead and first I'll shake, or I'll gently roll the NPH solution, making sure to not shake and not roll too fast. Okay, that looks good and mixed up. Okay, now we'll go ahead and clean off each top of the vials for 20 seconds with the alcohol swab. 20 seconds on this one. Okay, now I'll throw that away. Okay, now we'll get out our insulin safety syringe. Okay, and now what we're gonna do is we're going to inject 10 units of air into our NPH insulin. Okay, I'll just check with my second nurse to make sure that's 10 units. Okay, and then we will pull off the, oops. Okay, and we're going to inject it into the cloudy solution first, 10 units. Okay. Now, we are going to get 2 units of air. And I'll just confirm that with my second nurse. Okay. Now I'll inject that into my regular insulin. And then I'll turn this out. And then I'll draw back. Two units. Okay. And then I will check with my second nurse. Okay. And now I will take this back off and I will draw 10 units of NPH to get to 12 total units. Okay, now I'll check with my second nurse. Okay, and now that that is all done, we will go ahead and compare that for the second time against the MAR. Okay, that looks good. I'll put that out on the table. Okay, and then next we're going to go ahead and prepare our ceftriaxone for UTI. Okay, I'm going to go ahead and compare the vials for expiration dates, as well as the check for any damage against the needles and syringes. And then I'm gonna go ahead and compare these 2 vials to the MAR, make sure they are correct. And then we're gonna go ahead and do our dosage calculation. Okay, and we have ordered 0.5 grams for IM injection every 12 hours for 5 days for a UTI. What we have available is 1 So we're gonna go ahead and do this dosage calculation. Change grams over to milligrams. 500 is what is ordered. 350 milligrams is what we have. And then we're gonna go ahead and multiply that by 2.1. That's gonna go ahead and give us 1.4 milliliters. Okay. So go ahead and pull the top off this one, toss that. And I'll clean each with alcohol wipe for 20 seconds. Okay. I'll leave this in the package until I need it. Okay, so I'm going to withdraw 2.1 milliliters of solution into my powder. So first I'm going to go ahead and draw back 2.1 milliliters. Okay, you can see that that's 2.1 milliliters of air drawn back. Okay, and then I'm going to go ahead and get my safety needle. Okay, pull out the safety. I'll pull off the top. We're going to go ahead and insert air into solution. And we're going to go ahead and put that on back. Go ahead and check that that is get out any air bubbles you see, and then just make sure and check with my seconder. So that's at 2.1 milliliters of solution. Cap off, and we're gonna go ahead and inject this powder. Okay. Take this off, and we'll be putting these in Shrub's container. And then we'll go ahead and roll this between our hands gently. Until it's all mixed up. Okay. Perfect. Now we'll go ahead and take out our other safety needle. And then we will draw up 1.4 milliliters. Oops, let me go ahead and drop the air first. So 1.4. I'll just check with my second nurse. That's 1.4 milliliters of air. Like that. And then we will about 1.4 solution. Okay. Go ahead and make sure there's no bubbles. Okay, I'll check with the second nurse. So that's 1.4. Okay, now that that's said, prepared, I'm gonna go ahead and check that second time against the MAR, make sure that's all correct. And it looks like it's all good. We'll just put this over here and we're ready for it. Okay, the next one we'll do is gonna be the, let's see, cyanocobalamin. Okay. So the doctor has ordered, I'll go ahead and check out the expiration date of my medication, and I'll check that I got the right one out, check for accuracy, and then make sure my needles are good, my syringes. Get my filter needle as well. Okay, so this one has an order for 200 micrograms. Cyanocobalamin. So 200 micrograms. Iron injection. We'll just do our dosage calculation. 200 micrograms, and we have available 1,000 micrograms. So that's gonna go ahead and give us, and then you wanna multiply that. Okay, so you just take 200 divided by 1,000, multiplied by the 1 milliliter we have available. I'm gonna get 0.2 milliliters. All right. So we have our ampule. I'm gonna make sure that all the liquid is out of the top. And then make sure our filter needle is available as well. Okay, so we want to make sure to go ahead and break this away. So I put that in the sharps container. Okay, and then we're gonna take our filter needle. withdraw 0.2 of air. I'll actually put that back on while I check for that. So I'll go ahead and withdraw 0.2 of air, check with my second nurse. Okay, now we can take that off. Actually, I don't know if we need the air because we're in an ambule. So I'll go ahead and flip this upside down. 1.2. Okay. Is open. Okay, and I'll just check with my nurse. Okay, now that that's administered, I'm going to go ahead and check that against the MAR. Now let me take away the needle. Now this is also ready for injection. Okay, and then we also have our tuberculin as our last one. Okay, and the doctor has ordered usual 0.1 milliliters. There's not any calculations for that. I'll go ahead and check for expiration of my vial, check if there's any damage. Also check for accuracy against the MAR. Looks to be good. Okay, now wipe the vials for 10 seconds. Okay. We're going to go ahead and withdraw 1 of air. Okay, I'll verify that with the second nurse. 0.1 milliliters. And then we'll go ahead and inject that. Here we go. Check if there's any bubbles. Okay, and then check my second nurse. Okay, perfect. All right, and then and then I'll check that one more time against the MAR as well, now that I have prepared it. Okay, everything looks to be good. I've done a first and second check. Now I'll go ahead and take my gloves off, hand hygiene, and then I'll go ahead and take this over to the patient's room. Hi Martha, how are we doing? Good. Well, my name's Hannah. I'll be your nurse for today. Can I verify your name and date of birth? Okay, perfect. Then can I take a look at your wristband? Okay. Perfect. Alrighty, let me go ahead and close your curtain for privacy. And I'll go ahead and wash my hands. Alright, so today we're going to go ahead and give you your medications for the day, okay? Okay. Can I ask your pain level on a scale of 1 to 10? Okay. Like a 6? Okay. And then you don't have any allergies to your medications, right? Okay. And do you need to use the restroom before we start? No? Okay. Well, let me go ahead and raise your bed up a little bit, if that's okay with you. And I'm just going to raise the head of your bed, since we're going to give you some oral medication so we don't choke. Okay. Perfect. Okay. Alrighty, Martha. Let me go ahead and put some gloves on really fast before we start. Do you have any questions before we start? No? Alright, so the first one it looks to give you is going to be your fluoxetine. So this is by mouth. And then once I'm at the bedside, I'm going to go ahead and compare this to the MAR. One more time. Okay, so I'm going to give you your cup of water. This is for your depression. This is your fluoxetine, 60 milligrams, okay? Here is that for you. Here's your water. Okay, alrighty. So that was your antidepressant. Let me go ahead and record that that was taken. Okay, and then any questions about that? Some common side effects are suicidal thoughts. People sometimes complain of dry mouth as well. No questions? Okay. So your next one I'm going to give you is your insulin. And I was told that you like to take one at 7:30 per request, right? Your Lispro and then your MPH, is that right? Okay. So this is for your type 2 diabetes, and we have them mixed, okay? And I'll go ahead and compare this to the MAR. Yep, everything looks good. And then this is going to go in your abdomen, and I'll be sure to rotate your side so I'm not puncturing the same site every time. It's going to be your subcutaneous injection. I'll wipe this off for about 20 seconds. And this is going to be your subcutaneous. Okay, we'll do that on your abdomen. This is going to be a 45-degree angle. 45-degree angle. 90. I'll go 90. Okay, ready? 1, 2. Okay, Good job. Perfect. All right. We'll go ahead and make sure that these get into the sharps container. Okay, and I will document that that was taken as well. Okay, and any questions on that? No? Okay. Some side effects to that one would be like low heart rate, high heart rate as well. Okay. So now let's go ahead and do your ceftriaxone. And this is going to be for your UTI infection. And that's going to be, we'll do that in your gluteal, ventral gluteal muscle. So put that right here. This is for your UTI. And some common side effects with this one is going to be seizures. I don't think you'll have any problems, but any questions? Okay. And I will go ahead and compare this to the MAR, the bedside. Everything looks good. Clean this for about 20 seconds. Okay, ready? 1, 2, 3. Okay, that is done. Okay, how was that one? Not too bad. I'll put this in the sharps container. Okay, now I'll put band-aids and cotton balls in all these as well. Okay. We only have 2 more. All right, so we'll go ahead and do your cyanocobalamin. This is for your vitamin B12 deficiency. This is also your IM injection. Okay, we'll compare this with the MAR. And this is going to go into your deltoid. Do you have any questions on this one? No? Okay. You might, another side effect would be seizures as well with this one. Okay. Ready? 1, 2, 3. Dispose of this as well. Is that not too bad? Okay. I will document that those were given. Both of those were given. Okay, now the last one is going to be for your, it's not really a medication, but it's for tuberculosis test to make sure you're not positive for tuberculosis respiratory infection. Okay, and with this one, you'll come back in about 48 to 72 hours and it'll be like a little bubble on your arm. And if it becomes hardened or has redness around it, then that could indicate that it's a positive test. But if it just goes away and it becomes smooth, then that indicates a negative result. Just go ahead and come back in 48 to 72 hours and we'll check it out for you. Any questions on this one? No? And that's just gonna go right underneath your skin. On your forearm, and I'm gonna just notice your forearms, making sure there's no bruises, scars, tattoos, anything that could warrant a compromised result. Okay, we'll go ahead and clean for about 20 seconds. Okay, and this is going to be a intradermal, so it's going to be about 15 degree angle. Okay, ready? Perfect, okay. All right, yep, so that's gonna be our bleb is what they call it. And if that becomes hardened or reddened the next 48 to 72 hours, just go ahead and come back and we will check it out for you. Okay, so that is all your medications for today. Okay, let me just go ahead and chart this. Okay. Good. Okay. Go ahead and take my gloves off. I'll do some hand hygiene. I'll make sure every needle and syringe is in the sharps container. Do you just want me to put you back down to where you were? Okay. Any questions or anything? You okay? And then what's your pain level at right now? So like a 6? Okay. Well, can I get you anything else before I go? No? Okay. We'll bring on to this side now. Go ahead and do one more hand hygiene. Here is your call light. I'll pull back your privacy curtain and I will document.